Okay, now we're gonna go over how to place topical anesthetic. So what you wanna do, we're gonna do a quick load of the syringe, which we just reviewed. So I'm gonna pull back on my syringe here, that's spring loaded. I'm gonna insert here my cartridge in, rubber stopper side down and release. I'm gonna use a new needle, I'm gonna hear it click. I'm gonna pull, establish a fulcrum, push down. Now this one is metal instead of plastic, so a little bit different. So the same concept, you're gonna screw it on until it engages in those threads. Now I'm going to engage my harpoon. Make sure that is secure, no wiggle jiggles. All right, so now, remember when I talked about saving this little guy, the other end of the needle? Remember, so it's kind of this portion here. So what we're gonna use this for is we're gonna put our cotton swab with our topical anesthetic here so that it's already our tray set up for when we bring our patient back. So this is our topical anesthetic that we use here. If you read it, it is a 20% topical benzocaine. Comes in different flavors, comes in mint, Walterberry, strawberry, bubblegum. Typically we don't ask the patient. Usually we'll have a mint in the adult rooms. We may have a fruity flavor in the rooms where we see the kids. Sometimes people will tell us if we use it, they hated the Walterberry, they will tell us, can I get a different flavor next time? Typically it's not a big deal, it's not on there very long, it's not going in the whole mouth, it's just going in a site-specific area. So what you want to do, unscrew your lid. This is our topical, it's like a gel. You're going to take your cotton swab. You can be pretty generous with it, so maybe a little much, but better to have a little bit more so we don't have to worry about not having enough and going back in and cross-contaminating. Now we're gonna take our cap and we're gonna actually place it in here. So now when we bring our patient back, it's all ready. We don't have to worry about opening this, touching something, and then touching this container, possibly touching the patient's mouth, and then contaminating, because if we contaminate this whole container, we have to throw this whole thing out. So I always get it set up before I even bring my patient back. Then I put this away. If I do happen to need more, then I will know. Clean gloves, new cotton swab, and I'll do it off to the side. So now, what we want to do, we always want to dry the area where we're placing the topical. So you take a 2x2 gauze square and we're gonna dry the tissue where we're placing it, because otherwise the saliva will really cause that topical to diffuse. A lot of times it will go to the back of the throat, patient will swallow, it can numb the throat, it'll have like the numbing feeling. They may panic. They feel like they can't breathe or they can't feel when they're swallowing. It's a weird feeling. So we dry the tissue, we try to isolate that topical right to the area where the injection will go, because that's the only necessary place for it. So what you want to tell the patient, I'm going to swing this around here to our mannequin head. I'm going to turn him a bit so we can see him. Okay. So the concept that we do is tell the patient when we seat them. What I'm going to do is place some topical anesthetic. This is going to numb the first few layers of the gum tissue, and then the doctor or hygienist will be in to get you numb. Okay? So now I'm going to get my cotton swab here. Kind of wipe it off the stick if you get a little on the stick. Kind of swirl it around here. So the way I'm going to hold this, in my left hand, I'm going to hold it like this. So I'm going to grasp it, and then I'm going to place my thumb over this stick. That way I don't poke. So what I'm going to do, I'm going to use this finger to retract the tissue, the lip, on the patient. So let's say we are numbing number 13 for a filling. So what you're going to do, I'll tell the patient, head back, chin up for me. I'm going to come around. on this side. You can stand while you do this, okay? I have my gauze in my right hand. I'm gonna retract the lip up. I'm gonna start kind of at the commissure, slide up, take my gauze, and I'm gonna dry the tissue up there. Just a couple swipes. Then I'm gonna grasp my gauze, and I'm gonna use these fingers to grab my stick over here. And then I'm gonna take my stick, I'm gonna place it right up at that injection site. I'm gonna rub it generously on the gums, swirl my cotton swab around, and I'm gonna place it there. Tell the patient, go ahead and close down for me. I tell the patient it is safe to swallow. The doctor or hygienist will be right in. We're gonna let that sit for a minute or two, and then they'll be right in to get you numb. So you can leave the patient, leave that stick in, go grab the dentist or hygienist. Now, when the dentist comes in, first thing you want to do, usually the dentist will come in, they will talk to the patient. Hi, how are you? All right, we're gonna go ahead and get that upper left numb for you. The assistant will then switch over to their side, which is gonna be the left side of the patient. And they're gonna tell the patient, go ahead and open up. You're gonna kind of twirl, pull down. Typically, you do not rinse at this point, okay? Now, when you go to pass the syringe, some dentists like you to pass the syringe and that transfer zone. Some, they will grab the syringe themselves from the bracket table behind the patient. It's all dependent upon the doctor and their preference, so you can ask. If the doctor wants you to pass the syringe, what you're gonna do is you're gonna hold it. You're gonna hold it as if they are gonna grab it, okay? This is gonna go on their fingers over across on the other side. So you're gonna pass it to them. You're gonna get a grip more at the base. You don't want your fingers in the way where their fingers are gonna go. So you're gonna hold it more in this area. Do a palm grasp. You don't wanna hold it right where the cap is. In case they go to grab it, the cap slides off, the needle will poke you or stick you. So you're gonna pass it like this. As the dentist grabs the syringe on the other side, you're gonna slide down and you're just gonna do a quick take off, okay? The dentist is gonna come in, or hygienist. They're gonna go ahead, they're gonna give the injection, okay? They're gonna come out. Typically, they'll then bring it on towards the back of the patient, put it onto the bracket table. Then, the first thing you wanna do as a dental assistant after that injection is given is give a good, thorough rinse. The anesthetic is very bitter tasting, and the patient is gonna want that taste out of their mouth, okay? So you're gonna grab your air water syringe and your suction, and you're gonna go ahead, tell the patient, turn towards me, use your air water, kind of retract, bring the suction in to retract that cheek, give them a nice rinse right up there, have the patient close, ask them, does it feel like that taste is out of there? Okay, great, just let me know if you need anything. We're gonna give that about 5 minutes or so to take effect. You should start to feel your cheek up here a little bit numb and the tooth, okay? That is just a place in the topical.